I was honored to be appointed BC's second seniors advocate earlier this year. I recognize the massive responsibility that comes with advocating for seniors. One of my first priorities was to meet with seniors throughout British Columbia. I wanted to hear directly from them about their experiences. I asked them to share with me what's working well, the challenges they're facing, and their suggestions for change. The report being released today details what I learned from those meetings and what we hear from seniors who contact our office on a regular basis. I traveled to 24 communities in April, met with hundreds of seniors, and heard from nearly 60 organizations providing services for seniors. I visited rural and urban communities, large and small, throughout our province. I met with people who have dedicated their professional lives to helping seniors access programs and services in their communities. I also met with seniors who volunteer helping other seniors. Their commitment means many older people in their towns and cities can access meal programs, can travel to appointments, or buy groceries. And they visit with seniors who live alone to help prevent loneliness, isolation, and social exclusion. Their commitment to their communities and to others is quite amazing. Seniors are the backbone of volunteerism in British Columbia. Without their dedication, many people would go without. But while I was encouraged by the amount of caring and compassion I saw, it is clear many people are struggling. I heard of the difficulties seniors face caring for a loved one as they themselves are growing older. I heard about couples being separated. One woman told me she travels once a week over half an hour on a mountain road to visit her husband in long-term care because a bed wasn't available in her town. People express frustration with wanting to remain at home, but they can't find the help to manage some of the tasks of daily living. For many, there's no service available in their community. The wait lists are too long, or the support is unreliable due to the lack of staff and volunteers. I heard of seniors paying thousands of dollars in travel expenses to access medical care here in British Columbia. One man who plans on working into his 70s told me he wasn't sure how he would manage because he will lose his employee extended health benefits just because he's turning 65. Others told me of the enormous change in a senior's life when they can no longer drive. In many communities, there are no affordable or viable transportation options for seniors. As a result, they feel lonely, isolated, and excluded. Overwhelmingly, though, the number one issue I heard when talking with people in every community I visited is affordability. Many low-income seniors are having trouble paying rent, buying groceries, covering mobility aids, and other costs that aren't paid for through our publicly insured healthcare system. 1 in 4 seniors in BC live in incomes of less than $23,000 a year, which is below the poverty line. Many seniors on fixed incomes, and they don't have options to earn more money to cover increasing costs. I was told more and more seniors are using food banks and accessing community meal services and are at risk of homelessness. One benefit that provides a little relief is the BC Senior Supplement. Low-income eligible seniors may qualify for this monthly income top-up. The maximum monthly benefit for a single senior is up to $99.30. That's 70% of recipients do not receive the maximum. The supplement is also not indexed to inflation, and it's the 4th lowest benefit of its kind in Canada. Low-income seniors who rent may also qualify for the Shelter Aid for Elderly Renters, or SAFER program. Unfortunately, the recent changes announced don't go far enough. It's meant for low-income seniors to pay no more than 30% of their income on rent. The SAFER benefit is also not tied to allowable rent increases nor to inflation. When the rents go up, there is no corresponding safer benefit increase for recipients. When a senior's federal pension incomes goes up because it's tied to inflation, the safer subsidies clawed back, leaving them no further ahead. Let me break this down a bit. For the average safer recipient, the average monthly rent is $1,737. The average rent is $1,116 because they have been living in their apartment for a while. The safer subsidy increase taking effect in August, in this example, the increase is $115 per month. This change means they will be paying 43% of their income on rent. The extra $115 does not make a substantial difference for the lowest income seniors who rent. 43% of your income on rent is well above the program's designated threshold of 30%. Now, the story is even worse if a senior has to enter in today's rental market or move from the current apartment where they've been living for years and likely enjoying a low renter price. The CMHC market rent in Vancouver for a one-bedroom last year was just under $1,700. I think it's safe to say that if you're trying to find a place to live and your rent is that much, it'd be very difficult to find that in today's market. This means even for the new safer changes, the senior will be paying 76% of their income on rent if they had to find an apartment in today's market. This puts them at risk of homelessness. Improving safer and increasing the BC Senior Supplement are two changes the provincial government could make today that would substantially improve the quality of life for seniors in BC. Seniors are the fastest growing population group in British Columbia. Currently, 1 in 5 British Columbians is 65. By 2036, just in 12 years from now, 1 in 4, 25% of BC will be a senior. Then, the oldest baby boomers will be 90 years of age. We're generally healthier and living longer. More people will be over 65 in the next decade, more than any other time in our history. That's good news. But the question is, are we prepared? The short answer is no. At age 85, seniors begin to rely much more heavily on our publicly funded healthcare system. I heard from seniors and service providers, assisted living and long-term care are not available in the right place at the right time. There are demand and supply issues now and will only grow exponentially in the coming decade. Seniors say there are often no options for long-term care or assisted living in their home communities. Due to these challenges, my office will be undertaking a systemic review of access and wait lists for long-term care and assisted living. There are also very few affordable senior housing units available in some communities. Even if a senior wanted to sell their home, there may be nowhere locally for them to move to. We also know that despite a major increase in the seniors' population, which is fast approaching, seniors feel invisible and forgotten. Services are fractured, not coordinated, and seniors don't know where to go for support when it's needed. Several ministries in BC have responsibilities for supports and programs for older people. I'm urging the provincial government to develop a cross-governmental plan in order to improve services and prioritize the needs of seniors. 95% of seniors live in their own home. The vast majority of seniors want to live independently in their own home for as long as possible. But seniors told me they don't have what they need to age in place. Home support is not providing enough care for seniors to live well at home. A senior with an annual income of $30,000 a year must pay $9,000 a year for 1 hour daily visit of home support. For every $3 they have, they're spending one of those dollars for home support. Low-income seniors receive services for no cost, but a senior with an income above $30,000 must pay and pay a lot. The fees are cost prohibitive for many who simply can't afford it. It's important to point out that the majority of provinces in Canada do not charge for home support services, and this includes Alberta and Ontario. BC does charge, and is one of the most expensive in Canada. Our office has repeatedly urged government to lower the cost and increase availability of home support services. Despite some investments, the fees remain high. Many seniors aren't able to access subsidized home support services, or they don't get enough care. Home support also does not provide non-healthcare related tasks that seniors cannot manage on their own. However, the Better at Home program does provide services like housekeeping, grocery shopping, transportation, and snow shoveling for low or no cost. Seniors appreciate this program very much, but they need more of it. The program must be bolstered to meet the increasing demand now, and even more in the years to come as our population of seniors grows. To remain at home, many seniors also need community support services. Seniors and service providers told me more funding is required for senior centers and those community centers to provide services such as meals programs, digital literacy education, social and recreational activities, and local service navigation. Many centers don't have a single dedicated source of funding, but provide vital support for many older people. I also heard from seniors who want more preventative health care. Specifically, they mention more vaccination coverage, the shingles vaccine in particular. 1 in 3 Canadians will get shingles, and seniors are more at risk. The cost of the vaccine is $300. I think we all can agree that the cost of treating someone who gets shingles is more than $300. Therefore, I want the government to make vaccines available specifically for shingles for free for seniors at no cost. On a personal note, I want to thank everyone who took the time to meet and share their experiences. I heard many personal and difficult stories from seniors in communities large and small. Your input was invaluable and very much appreciated. And the information you provided has contributed to this report. My full report outlines the many challenges for government that, if addressed, would improve the quality of life for seniors in our province. But these are the top actions government must take now. Firstly, redesign the SAFER program to provide immediate financial relief for low-income senior renters. Number 2, increase the amount of the BC Senior Supplement and index it to inflation. Number 3, eliminate the daily charge for home support. Number 4, implement a publicly funded shingles vaccine program. And 5, develop and implement a cross-ministry strategy and action plan for seniors. To conclude, it's Seniors Week, and I wanted to release this report this week to amplify the voices of older people in BC. I'm passionate about improving the lives of seniors and eager to take on this challenge as BC's new seniors advocate. It's clear we have lots to do. It's in all of our interests to make the needs of seniors a priority. If we live long enough, we will all become seniors one day.